Thank you, Mr. Chairman. And I also want to thank our three witnesses who are going to be testifying today. America's been through a lot in these past few months. We've seen the best in people, from our frontline workers who've risked their own lives to help the sick, to our doctors and nurses who have struggled as well but continued to show up, the innovation from educators, small business owners who struggled but worked to make payroll, researchers who are working tirelessly to find a cure. But I don't think enough credit has been given to the teams that the three of you represent and the work that you've done to help America respond to this crisis. We faced an unprecedented logistical challenge, a global pandemic that hit our shores while China was hoarding needed medical supplies as they were lying to the rest of the world. I had some experience with these kind of challenges when we went through Hurricane Katrina. And while Hurricane Katrina hit a limited area, this pandemic hit this entire country. It had hit the entire world all at the same time. So as you can imagine, the incredible challenges that brings with it when you're not just dealing with an isolated crisis, you're dealing with a global crisis, and you have to respond fast. The incredible work that your teams have done to ramp up production and distribution of PPE, as well as testing the equipment that's needed, getting facilities up and running. We owe the men and women of your teams a tremendous debt of gratitude, and please let them know how much our country appreciates the work that they did in these trying times. Mr. Chairman, as America gets ready to celebrate our Independence Day on 4th of July, we also confront an important moment in the coronavirus pandemic. We've learned a lot, and those lessons have saved lives. As you know, my home state of Louisiana, and specifically the city of New Orleans, got hit early in this pandemic. New Orleans faced some of the earliest hospital capacity scares. The reason that economies were shut down was to flatten the curve and make sure hospital systems were not overwhelmed. In those darkest days when there was a concern about a shortage of ventilators, I want to personally thank Rear Admiral Polachek, because I remember speaking with you specifically, as well as with FEMA Director Gaynor, about the concerns our state was facing. My governor and I worked together, and the administration responded, and y'all delivered those needed ventilators to us. I know you did the same for New York and other regions that were concerned that they would hit that shortage. And fortunately, we never did hit that shortage thanks to your quick work. And I remember that phone call was on a Sunday, and you were there and you delivered. So I'm sorry, Mr. Polachek. So I appreciate what you did and what your team did to respond so quickly. So please convey that thanks to them. It surely helped our state. It helped the city of New Orleans be able to respond. I just want to point that out so that people know there was so much done behind the scenes by the administration to respond. Doctors learned how to safely treat patients without necessarily putting them on ventilators. Doctors are not intubating as aggressively as they used to. They're using a high flow of oxygen instead because they've learned that intubation can actually do damage to the lungs. They've learned how to keep healthcare workers safe with other treatments. While some still need ventilators, demand has dropped and patients are seeing better outcomes. The use of simple blood thinners is saving lives because autopsies showed that patients were getting massive blood clots in the lungs. Steroids and cures like remdesivir are showing tremendous progress. Even as we see a spike in cases in areas of the country, the death rate has actually dropped. We've also learned more about who is most vulnerable and how we can better protect those populations. For example, we know that the policy of prohibiting COVID-positive patients from returning to nursing homes saved lives. In those 45 states where the governors, Republican and Democrat, followed the guidelines, we saw dramatically lower death rates among seniors in nursing homes. Sadly, we also know that policies that mandated that COVID-positive patients be returned to those nursing homes, even if the nursing homes weren't capable of properly taking care of them, turned out to be a death sentence for many seniors. We still haven't gotten the answers that we deserve to get, so we can learn more about that. And I would again ask the majority if we could join together, not just some of us, but all of us, ask those 5 governors who decided to go against the CMS guidelines if they would share those answers with us and with the rest of the country, and most importantly, with the families of their victims who are still demanding answers. And we're going to continue to press for those answers. The hard-won lessons, including the lessons that we need to keep learning, are underscored by the spike in cases in particular areas of the country. The virus continues to spread. It's not an even spread, as we've seen. In fact, cases are dropping in many areas of the country. We've learned that this virus tends to spike in concentrated areas, and it does so rapidly. And there's a lot that we can learn from applying those simple recognitions. What I would say to the young people of America is you've worked hard. In many cases, you had to homeschool. You had to deal remotely with the ending of your education, maybe not able to start your new career in the world as you were expecting. But as you're experiencing more freedom, that freedom comes with responsibility. We're seeing that spikes are primarily affecting young people. And we're learning a lot about young people getting together in very crowded areas has actually expedited the spread. So we just urge young people to avoid that spread. Learn from the things that we're learning. You surely don't want to be sharing it with your parents and grandparents and putting more people at risk. All Americans should follow the CDC guidelines that continue to get updated. Wear masks where it's possible. Maintain recommended social distancing. We know how important social distancing still is. We all need to do our parts in stopping the spread. We must also recognize how much better prepared we are today. We're currently conducting over 500,000 tests. We've got a chart right back here that shows the dramatic increase this country has done responding to the shortage of tests that we saw back in March, where they were almost non-existent. You saw the president expedite through Operation Warp Speed to push more things, including the Defense Production Act, to increase testing to the point where today we're conducting over 600,000 tests a day. We still need to keep growing this number, but you can see that dramatic increase to see how the administration has continued to respond. Nobody's letting their foot off the gas, but it's important to notice how we've come together, even with China hoarding and lying to the world, how we've picked up the pace and done more on our own. Mr. Chairman, while some states have experienced rapid spikes that we need to watch closely, all Americans need to know the following. One, there is not a single state in this country that has reached hospital capacity. That was the main barometer in what states use to close their economies. That continues to be the most important barometer to watch as we safely reopen economies. Number two, our doctors have a better understanding about how to treat patients, and we've seen that from less use of ventilators, more use of therapies like remdesivir, which are showing great promise. Number three, we know how to better protect our most vulnerable populations, and we hope, as most governors followed the proper guidelines and saved thousands of lives, that the other governors would follow that lead. Four, we know that tremendous progress continues to be made on vaccines and therapies. We need to make sure to get government out of the way. It is shocking that this week, as we're pushing everybody, government, private sector, all people, to do more to try to find a cure and to slow the spread, that the majority party would bring a bill to the floor this week that, according to the Council of Economic Advisors, would actually make it harder to find cures for diseases. As we're pushing all of government to find a cure, the bill that was brought to the floor of the House this week, which many of us opposed, would actually, according to them, maybe bring 100 fewer drugs to market. We're trying to get more life-saving drugs to market, not fewer. Hopefully that will not be the trend that continues. And finally, five, the role and responsibility of individual Americans to stop the spread is better understood and needs to continue to be followed. So, Mr. Chairman, as America continues to move forward, hopefully schools will start reopening, businesses will continue to reopen, we'll continue to learn more about how to better protect ourselves as we live with this disease, as we confront this disease and this challenge. I look forward to the discussion, look forward to hearing from our witnesses. With that, yield back.